Everybody, I'd like to introduce you to Shirley Goss. Shirley, thank you for joining me today just to talk about your recent experience of using this, Judy called it, serial casting technique on a patient that had two fixed flexion deformities of his little and ring finger. Thank you for sharing your experience with us.
Yes, I had a patient that the contractures of the PIPs were like around 52 on one finger, 45 on the other. And they were very stiff and nothing was working. I used traditional therapy. I used, manual techniques to try to help. We've even done, I did do some casting and realized the Sims casting in one position and minus position, and I probably had it a little too loose. I probably should have straightened the contracture at first. And but anyway, when he used it, the bad thing is that he used the hand, and it's really important to use the full forearm. I've learned that.
Okay.
And so, yeah, so I don't know if he was consistently using it like he should when you're on a forearm where you're 24 hours, 7 in that.
Yeah.
Yeah. So anyway, I did use the serial casting because I felt, okay, nothing is helping this guy. He needs something that's going to be 24/7. And he agreed because he would have at least his index and thumb to be free. And we got great results. We did 3-week series, about 5 days, and we would change him every 5 days. And I was afraid that he would lose. I was nervous the first time, to be honest, but then I was like, okay, this worked out pretty good. And he was excited about it, and because we measured him each time. And we just, in 3 weeks, I think, because he just sent me a picture, and it looks like he's almost completely straight. And
he is. I saw it. It's incredible. So how did you used to treat these fixed flexion deformities before?
I would use thermoplastic splinting, either nighttime, or sometimes I use spring load dynamic splints, but I wasn't real crazy about that because I don't, the ones that you buy on the market, I just feel like they're just too harsh on patients. So I kind of shied away from that. I use, because for him, he had a lot of scar tissue as well, besides the joint. I use elastomer putty or some kind of gel for scar issues, and joint mold, just about everything you can think of as traditional heat. Yeah, yes,
okay.
and stretching in heat.
Did you ever use POP just over the PIP joint and just the finger? Because this design extends, supports the MCP joint in neutral, and it extends into the palm. Did you ever try serial casting just using the finger?
No, I have not. Actually, This is the first time I've actually used it, but
POP.
I could see where that wouldn't work. I could see where, because you do need that full length of the cast, because I've used thermoplast that way. Let me put it that way. So, and I know that doesn't work.
It doesn't work. And I see it a lot online, and that's why I was wanting to discuss it. And the main reason is because you're getting that 3-point pressure, but you need that surface area in order to really get the extension of the joint. And the other beautiful thing is that you're never casting over the dorsum of the PIP joint. The way that the design is that that's left free. And because you gave yourself 3 weeks and you changed it every 5 days, you really did give the tissue a chance to adapt to the new position. You didn't just go and really crank that joint and put the patient in severe pain. You worked with the tissue, resolved that joint contracture slowly over time.
Yes, and he did say that he was comfortable in it because he had really high pain, and the pain progressively got lower.
Yes.
And it was amazing.
Oh, your smile says it all. So I'm really glad. I think you achieved an excellent result, and also you did this doing both fingers at the same time. It's very tricky to do 2 adjacent fingers because the plaster of Paris is quite bulky. It does need to be bulky, and so you rose to that challenge.
Yes, I was nervous about that at first, and I gave him my phone number and I said, okay, just call me if there's any problems. We could just have you remove one of them. But it worked out. I think it's because it was the two ends of the fingers and you're able to abduct a lot more with the small finger. But I was afraid he would get uncomfortable, but it seemed to work fine.
I think you made him more comfortable because it's not comfortable to have a fixed flexion deformity. And I think he could start to feel the ligaments relaxing and the finger extending. So I think you just did a brilliant job. So well done.
Thank you.
And thank you
Thanks
for
for your
sharing.
help.
Only a pleasure.